Hi guys, I'm Kaylee Oppenheisen.
And I'm Stephanie Osborne, and we're going to give you a little information on playing catch today. According to AOTA, the activity of playing catch falls under performance areas of occupation. Playing catch is classified as a play and leisure occupation. It is an organized activity that promotes a number of positive outcomes such as pleasure, satisfaction, health, and general well-being. It has both physical and cognitive benefits and is relatively simple to initiate. There are 4 basic steps to playing catch: wind up, follow through, catch, transition ball to throwing hand, and then you repeat until you're satisfied. Playing catch is an activity that requires heightened sensory motor integration skills. Visual motor demands are particularly important for tracking an incoming ball during the catching phase. Maintaining appropriate visual perception is especially important for providing a safe outcome for the activity. In addition to sensory perception requirements, there are a number of physical and cognitive skills needed to complete the activity. Fine motor skills and dexterity, for example, are necessary for manipulating the ball between the palm and fingertips. Bilateral integration is used throughout the activity for coordinated upper and lower extremity movements. Praxis is needed to carry out the step-by-step process of the activity while also planning motor movements to adjust to varying ball trajectories and different partner situations. Cognitive skills are also important for maintaining alertness, applying short-term and long-term memory for skill acquisition, and handling the performance effects on the participants. Playing catch is an activity that can be applied in many different situations. It has a high level of social meaning because it requires at least 2 people to participate, which makes it a fundamentally social activity. This is a play and leisure task that is typically learned by age 3. It is relatively simple to understand, and it can be played by people of varying ages, skill levels, and physical requirements. Playing catch can have cultural meaning as it has implications of popular team sports such as baseball and football. Depending on the context, playing catch can also be related to work settings. Professional athletes, for example, often rely on their ability to play catch in order to demonstrate their athletic talents. This activity is one that can be used continually throughout a lifetime and can be passed down from generation to generation. As a play and leisure activity, playing catch can be an excellent tool for facilitating psychological well-being. The activity influences relationship development, general happiness, skill development, and self-confidence. Participating with others to play catch is a valued activity in American culture, which helps to facilitate satisfaction and belonging within a community. Depending on the context, playing catch can also involve many challenging physical movements such as running, stretching, and jumping. Participating in such dynamic activities helps promote both physical and mental health for the players. In general, this activity requires having at least 1 partner and a ball. The ball can have varying size, weight, shape, and color. However, it must maintain reasonable dimensions in order to accommodate the skills of the people participating in the activity. A glove, a basket, or some similar catching device may be helpful in facilitating efficiency, but it's not necessary. For safety reasons, there should be at least 8 to 10 feet between partners. This activity can take place inside or outside and at any time during the day. Many of the activity requirements are visual in nature, so there should be plenty of good lighting, few distractions, and minimal obstacles within a 10-foot radius. Playing catch can be done in pairs or in a large group setting. Depending on the intentions and the skill level of the players, the activity can vary greatly in time requirements. The complete process of playing catch can be as short as 5 seconds, but can last as long as the participants desire since there is no definitive point of completion. Playing catch can occur in various contexts, such as family gatherings, socializing with friends, preparing for sports events, and exercising with peers.
The act of playing catch inherently involves social interactions. It requires a minimum of 2 players, which is an opportunity for social participation. There are varying social demands which are dependent on the purpose of the activity. A young child playing catch with their parent uses the time as a bonding experience. Late childhood and early adolescence brings the influence of team sports, including baseball, softball, and football. Playing as a team member is a chance to develop social and emotional skills. It is an opportunity to establish trust between teammates, build self-confidence, and learn about sportsmanship. In middle adulthood, playing catch may be a teaching experience as a coach or parent, or a leisure activity played on a club team. A grandparent may play catch with their grandchild as a teaching and bonding experience. With older adulthood, the act of playing catch may lose personal meaning and relevance. Physical ailments tend to limit ability to engage in this activity. Catch may be replaced with activities such as shuffleboard or bingo. Previously developed social skills from past experiences transfer well to such leisure activities. Over the lifespan, catch is both a play and leisure occupation that leads to social engagement and participation. There are potential safety issues to consider when playing catch. Speed of pitch, accuracy of thrower, and ability of catcher are all factors which affect the risk of being hit by an incoming ball. It is vital that the thrower and catcher are aware of each other by mastering nonverbal communication to determine readiness. The pitcher should make substantial eye contact prior to releasing the ball. This connection helps prevent injuries that may occur due to the catcher not being prepared. Spacing should be determined based on the physical demands of the activity. For our purposes, the ideal distance is approximately 8 to 10 feet between players. The players should also be aware of obstacles in the room and remove them if necessary. We recommend playing in a familiar and spacious area such as your living or dining room. Playing catch is an activity that is engaged in across the lifespan and around the world. North America in particular has a fascination with playing catch as a theme, with the most popular professional sports being baseball and American football. However, all cultures use catch as an activity to play with children. Play is the dominant occupation in early childhood, and a toddler uses catch to explore the world around him. This activity aids development of sensory motor modulation skills, hand-eye coordination, and hand dexterity. Playing catch is a relatively inexpensive activity as the only required material is a ball. The iconic baseball can be substituted with most lightweight, small objects such as a stress ball. There is a potential to spend excess dollars on the sport, which may require gaming equipment including a baseball or softball, bat, mitt, helmet, and uniform. There is not a large percentage of people who use this activity as a way of earning income, but it is possible. Coaches and professional athletes play catch as a work occupation. Performances in these arenas are intense, require great skill, and are observed by a large audience. Gender roles also factor into playing catch as a team sport. Males and females are typically separated by gender into baseball and softball leagues, respectively. Male athletes are expected to have greater skills than girls, which is largely due to upper extremity strength that impacts throwing speed. The activity relies heavily on nonverbal communication. If a social, cultural, or language barrier exists, players can still participate. Playing catch can be a tool to build emotional and psychosocial skills. When played in a safe environment, it offers a steady and trusting relationship. This specific activity affords equal participation between players. The thrower and catcher reciprocate roles continuously throughout the activity. Players always throw back to their partner and are willing to catch for them. If playing for sport, there are more psychological stakes. There is intense preparation involved and increased pressure to perform. If players are accurate and win games, it can build confidence. Even with lost tournaments, being part of a team offers a sense of community and social support. Winning and losing teaches players emotional regulation and coping skills. There is also a nostalgia component to playing catch, which brings back memories of past experiences with the activity. It may be an opportunity to remember family members that have passed or recall an incredible victory. The expected outcome of this activity is to participate in a social event, improve throwing and catching skills, and engage physical body structures and exercise. Objectively, we hope to connect with the ball. Depending on the context and purpose, this goal may be to simply engage in the activity. Physical and emotional stimulation may be the target outcome, with less focus on accuracy. We chose MOHO, the model of human occupation, as an applicable theory for this activity. This frame of reference is client-centered, which accounts for varying needs of the person, task, and context. One fundamental concept of MOHO is the biological need to be active. Cole and Tufano describe the importance of play and leisure activities relative to temporal, physical, and socio-cultural context. The meaning and purpose of play and catch is determined by stage of life, performance capacity, task demands, and social and cultural relevance. Volition to engage in daily occupations is entirely subjective. Playing catch as a leisure activity is intrinsically rewarding and therefore motivational in nature. When playing for sport, there is the extrinsic reward of winning a game, which prompts players to perform in a more demanding role. Function is defined by MOHO as the ability to adapt skilled performance to person, occupation, and environmental demands. Playing catch can be modified or graded based on client-specific factors to create an adaptive response. There we go.
Oh. A therapist may modify this simple task to increase the difficulty by using a smaller ball, asking the client to throw and catch a ball at the same time, or randomly alternate throwing and bouncing the ball. Increasing the distance between partners requires faster speed, improved accuracy, and precise hand-eye coordination to execute both throwing and catching tasks. The activity can be adapted to meet client-specific needs. Scarves or balloons could be used in place of a ball to increase air time if more time is needed for mobility. A Velcro mitt may be used if the individual has limited hand dexterity.
Oh, shoot.
Playing catch is a meaningful activity which can be utilized in occupational therapy practice. It can be adapted and graded to accommodate population-specific needs across the lifespan. For young children, play is the primary occupation. Playing catch in early childhood is an opportunity to learn cause and effect, develop trust with loved ones, and refine hand dexterity. The adolescent population may desire a more challenging approach to the game. OT services can help an athlete regain function after injury. An OT could also modify the task, the environment, and/or the equipment for teens with spinal cord injury by creating an adaptive sports league. According to the World Health Organization, leisure activities are opportunities for health, participation, and security in order to enhance the quality of life as people age. Playing catch as a leisure activity can improve the overall well-being throughout adulthood. For our activity, you're going to need your Mary Freebad stress ball. You should stand upright with legs shoulder width apart, and with your partner, you should be about 8 to 10 feet away from them. You should remove all obstacles or potential safety hazards, and if needed, you can grade the activity for your setting.
All right, step 1. Wind up. Use your dominant or preferred hand to grasp the ball. Now you're going to cock back the dominant upper extremity by elevating and externally rotating the shoulder. You'll want your elbow to be flexed to about 90 degrees, and then you're going to pivot back on your dominant lower extremity by stepping from the frontal and into the sagittal plane. You're also going to want to elevate and extend the non-dominant upper extremity that'll be parallel to the floor, which will end up with your body in a T formation. I also want to note that as you step into the sagittal plane, your neck will rotate laterally to maintain eye contact with your partner, which is very important, and you're also receiving proprioceptive feedback, which will help you to interpret your arm's position in space. All right, step 2. This is the follow-through phase. Now you're going to step towards your partner with your lower extremity opposite of throwing arm. You're going to twist your trunk towards your partner, and as you do this, the midline will rotate along with the trunk. You're going to bring your throwing arm forward through a forward arc of motion towards your opposite hip. The release point of the ball is approximately when you're crossing the midline, but a little bit before. Your throwing arm should continue through the motion to touch the opposite hip. With practice, this step will become a natural, fluid movement. At the same time that your arm is going through those motions, you're going to maintain eye contact with partner. You're going to allow your non-dominant upper extremity to fall naturally to the side with the swing of gravity, and you're going to allow your non-stepping lower extremity to drag with excess momentum from the follow-through.
Step 3 is catching. You're going to assume your ready position with hips and knees slightly flexed to prepare for movement. You're going to bring both upper extremities in front of your body with your hands cupped at midline. You're going to want to maintain eye contact on the moving ball from the partner's release, and you're going to want to clasp your hands around the ball as it approaches a space within reaching distance of your body. And then step 4 is transitioning the ball to your throwing hands. You're going to want to supinate the non-throwing hand while maintaining grasp on the ball. You're going to grasp the ball with your throwing arm pronated. Move the ball laterally away from your opposite hand, and then use in-hand manipulation to bring the ball from your palm to the fingertips.
All right, guys, that's our presentation. Thanks for listening.